Okay, this one's going to get me in trouble. And I know what you're thinking. A lot of videos that are clickbait start with that. But this one I think really is. So I blame John Stenberg for asking the question. And the question is this. This is on the heels of a video I did about mastery and what it takes, and my opinion on what it takes to really become a master at whatever it is that you do, right, in life. Anything worth doing has a process to it, and I gave my thoughts on that on a prior video. But someone asked, in chiropractic, how do you know, there was a two-part question. How do you differentiate between actual masters and people masquerading as masters, right? That's the first question. The second question is, how do you know when you have become a master, right? So I do have an opinion on this, and honestly, it might step on some toes, because this is a pet peeve of mine. This is like one of the biggest pet peeves, and I'm really glad that John asked it. And I do have some thoughts on it, so let's just get into it. And if you care about these sort of things, great. I'd love to hear your thoughts on this. Those two questions, feel free to engage. But here are my thoughts. If you are a student in chiropractic schools, it's very unfair for someone to ask you to know the difference between true masters and people masquerading as masters, because you don't have the depth, you don't have the history, you don't have the receipts, you don't really know. So here's the litmus test that I'm going to give to you as a student of what to look for. And then I'll tell you how some organizations have litmus tests as well. But for me personally, number one, you better bring receipts. I want to see receipts, right? If someone is saying that they have some level of authority to teach a certain topic, I want to see your receipts. And the way I think receipts come in one of two forms. The first form is that you are certified by some sort of an educational accredited body that has certified you to be able to teach on the subject that you are teaching on. You are a certified instructor of an actual organization. Now let's talk about what an organization worth its salt means. And for this, I'm going to use the definition of upper cervical affiliate organizations for the Council on Upper Cervical Care. We have standards by which we certify technique organizations as being affiliate organizations of the Council on Upper Cervical. There's three primary requirements for being an official affiliate technique of the Upper Cervical Council. The first is you must have a board. You cannot be an army of one, and I'll get to that in a minute. Actually, I'll just get to that right now. If you are an army of one, if you are a guru, if you are a know-it-all, there's a problem with that. There's multiple problems. But the main problem is that when you die, your technique dies with you. And you're left with, something like, with all due respect, a lot of the knee chest organizations, when BJ died and when Michael Kale died, those men personified the technique. So when they died, everything scattered, and now you have multiple people teaching the same thing. So there's no virtue in going it alone. There's a saying out there that if you want to go fast, go alone. If you want to go far, go together. And so one of the first requirements for an technique to be an affiliate of the Upper Cervical Council is you have to have a board. There's so many benefits to this, of slipping and checking and growth and development and accountability, but that's the first thing. The second thing is you have to have a standards of care document. Your procedure must be based on research and have a standard of care, clinically speaking, that is valid and reliable. And the third thing is you have to have a certification process so that the certification actually means something. It means that you achieved and you accomplished a certain level of competency and proficiency and knowledge in the topic that you are teaching. So to know if someone is a master in a certain area, number one, the first of two that I have a suggestion here, is they have been certified by a accreditation body that actually says that they have achieved a level of competency to be able to teach. That's the first thing. The second thing is if they're not a part of that body, they better bring receipts on their own. I'm not saying that masters in chiropractic have to be part of organizations, although I wish they would. A lot of masters of technique go it alone because they don't like politicking and they don't like working with others, but it's to the detriment of the profession. So if you think you're good at what you do, I admonish you to get involved, roll up your sleeves, and make the profession better so we can go farther with your knowledge and skill. Otherwise, it dies with you. And the patients that you loved and cared for over the years suffer as a result, right? So, but if someone is in that, isolationist guru mentality where they want to be the monk on the hill that doesn't get involved, fine. But I'm not going to respect what you have to tell me unless you bring your own receipts. And what I mean by that is a curriculum vitae. So when I was going through the Diplomate program, I remember one of our instructors, we had the syllabi, the course outline, and we got a copy of his, I think it was David Harshfield. He's a orthopedic radiologist, interventional radiologist out of Arkansas. And his curriculum vitae is like a small textbook. It is so large. And inside of a curriculum vitae, you can expect to find a few things, not just what you've learned, but what you've done. So typically in a curriculum vitae, you will find things like research that you have published or co-published or co-authored. You will find the number of presentations given and on what subject matter. You will find how many seminars you've taught and on what subject matter. So I want to see your experience and your knowledge base in the thing that you are purporting to teach me. If you don't have a certification from a governing body, like suggestion number one, then you better have your own receipts to show me why I should be listening to you. Otherwise, what you get, what you hear from people, the fakers, is they will say words like, in my clinical experience, or what I've found clinically to be true. Like, I don't care about your audience of one, your sample size of one, I don't care about that. I want to see reliability. I want to see validity in what you do. Chiropractic is a clinical art. It is not a philosophical expose. It is not a marketing business mastery thing. Chiropractic is a lot of things, but one of the main things when it comes to learning the procedure is that it is a clinical thing. So you better bring receipts of reliability and validity. And normally you get that from organizations that have stood the test of time, see requirement number one, or you've done your own due diligence to prove reliability and validity on what you are doing on your own, right? So to me, that answers the first question. How would I be able to distinguish the true masters from those that masquerade as masters? Is they bring receipts. But before I go on to question number two, is how do you know when you become a master? Let me just insert one more little soapbox here. Nothing drives me more crazy than people that put their name on something that they think is somehow new, or they put their spin on something that's been around a long time, and they repackage it and relabel it and make it their own when it really wasn't their blood, sweat, and tears in creating it. And they don't have the first two criteria. They don't have the board certification, and they don't have their own receipts. And they go and they start a new certification process, which is nothing than a printed PDF off of Google that they stamp their name on and fill in your name as a student, and then you think like, oh, I got this great certification from Joe Schmo Bader, technique, and you become a master of it. But that's my crude joke. You're a master baiter. Like, you're an individual of one that has done nothing for the profession as a whole but glorify yourself. Meanwhile, you're really doing a disservice to the students that think that they're getting some worthwhile piece of paper, but it doesn't count for anything in a court of law or in a clinical setting most of the time, because you're really just learning from one person, which is fine. But in clinical research, if you want to learn from a master, they only become a master by putting in the work. There's not all the charlatans and all the shams out there are because people want so badly to have the recognition of the masters, but they have not put in the work. They have never done the reliability and validity for their procedures. They're riding the coattails of organizations that have, and they haven't had the temerity to humble themselves and put themselves through the paces of those organizations to actually not only get certified themselves, but to help move the profession forward in those organizations. They'd rather just go off and start their own when it's not even an organization. It's just Joe Schmo certification, which counts no more than the value of the paper that it's printed on. So there's my soapbox. To answer the second question, how do you know when you've achieved mastery in a given technique? It's sort of a self-owned trick question. You never reach it. You never reach it. Because anybody who is worth their salt, who has achieved anything in life over time, just realizes the truth that school is never out for the pro. School is never out for the master. The master is always learning. That's why I respect the heck. You go to these chiropractic conferences and you see people like Rob Kessinger, who probably knows more about anatomy and physiology, functional medicine, upper cervical chiropractic, thermology, all these different things, dysautonomias. He's probably one of the most researched and well-educated people in upper cervical. And he sits in the front row half the time. You know what I mean?
Keep left to
because
continue on
he's
I-80
learning.
East.
Because he's learning. So how do you know when you're a master? Is when you humble yourself to know that you'll never know it all. But you continue the pursuit. You continue the growth. You continue the work. And you put in the time.
On I-80 East.
And the other thing is, if you really want to know that answer and you want to have like some kind of a metric, you'll know that you're at least proficient.
For 21 miles.
You'll know that you're at least proficient when you are achieving the same results as the so-called masters. The beautiful thing about upper cervical care in chiropractic is that we have baseline assessments. We have objective testing to know before and after the efficacy of the intervention. So that's another thing of mastery, is you'll have a standard by which to be measured. Mastery is not like a feeling or a maybe or a something that you just have to feel. It's like, no, you should have measurable outcomes. Again, this is a clinical thing. This is not a philosophical waxing and waning or an artistic tapestry. These are objective things. And so at the very least, you'll know you'll have competency in a technique when, again, assuming that the technique is worth its salt, you can achieve the same outcomes as the masters before you. And when you can put yourself on par with the outcomes that they are getting, then you can at least acknowledge that your efforts have bore fruit, that you're not, sometimes I have an inferiority complex, and a lot of people that are, the quiet, humble, and I'm not quiet or humble to a degree, but what I'm saying is, on one hand, you never really call yourself a master. On the other hand, you do need to acknowledge your knowledge base and the work that you've put in over the years. And in chiropractic techniques, you'll know that you're getting there when you're achieving the levels of stability and clear outs in your patients that the instructors and masters of that technique were able to get before you. And that's why it's so critical in chiropractic to have standards, to have a standards of care document, to be based on clinical indicators that are reliable and valid. Because without those, anybody can be a master. Anybody. I could come up with some sort of a technique that claims to do amazing things. And how do we know those amazing things have happened? You'll feel it. You'll know. You know what I mean? It's like, no, you need reliability. You need validity. And so I think you can achieve proficiency based on those things. Mastery, I think, is something that the way you'll know is when you are achieving the results of the people before you, but yet you also know that you have not arrived, and you never will, and that's okay. I respect the heck out of those people. The people that bring the receipts, they've gone through the paces, they've got their certifications, they've done the research themselves, but they also know that deep down, this is a never-ending process. And I'm fortunate and I'm blessed to be on the journey, and I want to know the way, go the way, and show the way to the next generation. And to me, that's someone to be respected and someone to be followed. So, John, you may have gotten me in trouble, who knows, but thanks for asking the question, and you guys keep ticking out there. We'll see you around.